So now, do you tend to get more irritation on one side than the other? What have you been dealing with?
No, typically if I get it's left side.
Okay. Now, and down into this area too, or is it more so?
Here and then
Okay.
back there. Right
Okay.
about there, yeah.
Right up into that neighborhood there too. Okay. So that's kind of on the border of rhomboid upper trap area. So, so we'll address the anterior neck first. So when we're here, one of the things I'm going to use as a reference point is his SCM. Okay, because that attaches at the mastoid process, and then we've got the two heads attaching down at the clavicle and at the sternum, and so between the two, as we follow along that path, we're going to go right across portions of the cervical plexus. Got a whole lot of nerves with cutaneous branches that lay between the skin and the muscle. So as I palpate along here, man, I want you to let me know if we run into any discomfort.
There,
A little bit right in there, okay. And if I go a little bit lower, okay, I'm going to follow that down to the clavicle, a little bit down in there,
Yep.
okay. And then I'm going to follow a little bit further towards the sternum.
No.
Not so much there. So more clavicular head. Okay. Now I was trained years ago to like go in there and kind of dig it out and kind of pull it, and pincer it, and scrub it, and all kinds of stuff. Like really, it was the shit. And now I realize it was kind of just shit. So here's the deal: is that I just don't have to do that anymore. So so we're gonna come back up in here. Yeah. So you notice that he starts. He does the squinching the eyes thing. Okay, so we get into this area here. He doesn't like that too much. So what I'm going to do is that, I found a spot, and this is pretty much right along the path of his SCM, and I'm not worried about his trigger points in the SCM. What I'm interested in is like, how is he going to respond if I just move the skin over SCM? And what I'm going to do is I'm going to use the edge of my hand, and I'm going to shift myself off towards this side of his head, because there's a tendency that I've seen in some schools where they say, okay, now turn their head way to the side and then work on it. The problem is that a lot of people can't tolerate that.